Hey everybody, Eric Wilson with iCell Health Incorporated. Hope you're having a great day. Happy holidays to you as well. Wanted to talk about some very important things as the end of the year approaches, tax-wise that is. We keep hearing the politicians, if you watch the news at all, the fiscal cliff, the Republicans are saying this, the Democrats are saying that. Uh, if we go over the cliff, what happens to tax? Let's not tax the people making over 250,000. Let's not tax the middle class. Let's not tax the lower class. All those things you keep hearing about. What they're not talking about, however, are the taxes that are already going into effect in 2013 that affect everybody. Part of what the Affordable Care Act and slash Obamacare. There are some of the taxes. Some of the taxes have already gone into effect. There's like 20 total, but there are some that are going into effect January 1. Here are some of them. The first was the employer reporting of insurance on the W-2. That's on page 1957 of the PPACA. The surtax on investment income, that's in the Reconciliation Act, pages 87 through 93. That was a big one. That creates a 3.8% additional tax on the sale of investments, including your home. So if you sell your home, 3.8% of that is going to pay for Obamacare. Hike in Medicare payroll tax. You're going to see your payroll taxes all go down because you're paying more for Medicare. That's on the PPACA pages 2000 through 2003. Also the Reconciliation Act on 87 through 93. I love this one. The tax on medical device manufacturers. If a piece of medical equipment retails for over $100, and if you're ill, you need it, maybe a higher end wheelchair or a lift if you're paralyzed. A lot of things that cost more than $100. There's a new tax on that equipment that's passed on to you, the consumer. That's on pages 1980 through 1986 of the PPACA. High medical bills tax. Now you used to be able to, if your adjusted gross income, your medical bills were over 7.5% of that number, you could write it off on your taxes. Now it's got to be over 10. That's one that that's a tax. I don't know how people's bills get that high. I'm sure it happens frequently. Flex spending account, or your FSA that you have at work. There's now a cap of $2,500 you'll be able to put into your FSA every year. I have one as well. I don't put that much in it for myself purposely, but I put about maybe 1,000 in mine. But 2,500 will be the most you'll be able to do. Elimination of tax deduction for employer providing prescription drug coverage in coordination with Medicare Part D. That's on page 1994 of the PPACA. And then this one here. This one here drives me crazy. $500,000, $500,000 annual executive compensation limit for healthcare insurance executives. I assume that means the president of Blue Cross or the president of Humana or whomever can't make more than $500,000 a year. Okay, but it's okay for the president of the hospital to make that much or make more than that. Also, that's on page 1995, by the way, the PPACA. But the other part, I found this out, is the president of the American Red Cross has a salary of $651,957. That's okay. The president of the United Nations Children's Fund or UNICEF has a salary of $1.2 million a year. That's $100,000 a month, and that's okay. So we're not going to cap those people, but we're going to cap executives of the health insurance company solely because we're on the health insurance company, but they have to pay claims based upon the cost of claims, which comes from the hospital and the doctors, those kind of things, but there's no cap there. I just found that part very intriguing. Either way, they are the ones you know. There are 8 taxes that go into effect on January 1, but y'all should know. Hope you have a great day. Thank you. Also, there's the full, you can also read about all the taxes which are on my blog at icellhealth.com. Click on blogs. You can read about all 20 taxes and what pages you can find them on in the PPACA or the Reconciliation Act. Have a great day.